Hey everybody, happy Friday. Thanks for watching. We realize some of you may not know our backgrounds before coming out here to help with the COVID crisis, so we just thought we'd kind of fill you in on that, and then we'll go into answering some of our Instagram poll questions that we weren't able to the other night.
So my name's Carissa. I am an ICU nurse. I actually did 1 year of med surg and then have done ICU for like the last 4 years. I was doing most of my nursing in Tampa, Florida, and I moved to Maryland in November. So I've been doing travel assignments since then to try and figure out where I fit in.
So I'm Lauren. I'm from Colorado Springs. I'm an ICU traveling nurse as well. My first year and a half, I worked at Mayo Clinic on the med surg transplant ICU. And then I moved to Alabama to be with my now fiance, and I started traveling down there. And then I took a contract back in September in Colorado, and it just ended last week. So it felt like the perfect time to come help out with the crisis out here.
And in terms of how we know each other, is my brother is her fiance, so
Yeah.
we're future sister-in-laws.
So it's pretty cool that we get to do this together.
Yeah.
It's been fun.
So we'll start with the first question is, how did Lauren and I get to go to the same hospital and do this travel assignment together? Like she said, like her assignment was just ending and I was doing travel nursing as well. And we kind of started talking about it on Instagram, just chatting back and forth. And we both were surprised that the other person was interested in possibly going. The only things holding us back was our fiancés and our dogs having to leave them.
And obviously it's scary to come out here, but
we found a really awesome recruiter and company, which is New West. It's NU West. And we were able to work with her, and she worked really hard for us to try and get us at the same hospital in the same city so we could stay together and be able to use each other for debriefing at the end of the day and things like that.
And a big thing too was, like, I didn't really want to do a full 13-week contract out here just because that's a lot of time to be away from our fiance and dogs, like we said earlier. So we were able to do a 4-week contract, which I think is the perfect amount of time to be out here. And our fiance said go for it. They're both in the military, so they kind of get, the honor of going to serve and do your part in a crisis like this. So
how are we staying fed in a quarantined city? So that's kind of hard to answer because I don't feel like it's hard to find food, but it's hard to find time to eat. When we're working, we eat we get an hour lunch break, and we've been able to actually take our lunches, which is awesome. But there's not a lot of places in the hospital that feel like you want to open your food at. So we've been sitting outside in a courtyard. Thank goodness it's getting warmer
really
out.
Nice out.
So we've been able to do that. But our hotel room doesn't have a stove or anything like that. So we haven't been able to cook, although we probably wouldn't have time to, even if we did.
Yeah. We thankfully, with Carissa being from Maryland, she was able to drive up and bring a ton of groceries up for us. So we have stuff to make sandwiches and fresh fruit and all that kind of stuff. So
wine.
Lots of wine. The most important part. How does this compare to the COVID cases and intubation rates at your other hospital? And why do you think the intubation rates are so high there? So the contract that I just came from in Colorado Springs, there was quite a few COVID patients on the ICU that I was working in, but obviously not as many as there are here. And in this hospital, pretty much they intubate everybody that has COVID, and
They're just that sick.
Yeah.
That they need to be intubated.
Right.
If they're not sick enough, they send them home or send them to a different hospital.
Right. And so essentially, the whole hospital is turning into an ICU because the med-surg floors are now becoming ICUs. They've turned clinics that were in the hospital into ICU floors. And so
even office areas they've made. There was the unit that I've been on is an office unit that just holds people's desks, and they converted the whole thing into patient care.
Pretty much. I mean, it's the most intubated patients for sure I've ever seen. So I guess too with that, like, people are saying like, how are you managing like 7, intubated patients? Well, it's a lot different. The kind of nursing we're doing, way different than anything we've ever done before. So basically, we're keeping their drips, hung, managing their vents along with the respiratory therapist, but there aren't enough respiratory therapists. So we end up doing, a lot of the vent stuff, but, keeping the drips running, assessing vitals, and then we're teamed with a med-surg nurse if we're lucky, and they'll help with PO meds and other things, but like they don't even want us going in the room for like more than 5 minutes at a time because it's too risky for exposure. So we're trying to just like stay out of the room as much as possible. Oh, and then with that, they have the IV pumps are all outside the room. So like we just put extension tubing so that we're able to manage all the drips from outside the room, which is definitely different.
So when she says drips, essentially what that means is the IV medications that we're giving the patients. So in ICU, you have what we call drips. It's, let's say, a sedation medication, and it's continuously running into the patient, and us as ICU nurses are allowed to increase the drip or decrease the drip and how fast it's going into the patient to achieve the right amount of sedation. So these patients are on usually like multiple different sedatives, and then also a paralytic, as well as there are other medications that can also be continuously running in. So they'll sometimes have multiple IV pumps going at the same time.
Yeah. So, and then another thing people were asking is about charting. So we're only required to just write like a nursing narrative note at the end of this, at the end of the shift, just like, kind of the highlights of the day and if anything changed or any like major events. So that's been really different too, because usually the ICU is pretty extensive charting.
Why do you think the intubation rates are so high there? So, like I said before, the hospital that we're at just happens to be one of the hospitals in New York City that has the most vented patients, patients that are on ventilators or breathing support. So it's kind of hard to say how it would compare to our normal situation, especially because we didn't come from a crisis area. But I do know that like the area that the hospital is in is a very low income, a lot of homeless population. I heard that the area also has like the highest asthma rate. So I think that the demographic in the surrounding area, especially being really close to Manhattan, has people that have a lot of comorbidities, which just means they have a lot of other diseases or health issues already. So that's a lot of what we're seeing. I can't speak for if that's the case at other places.
Yeah, I'm not sure I know like the other hospitals are just as busy as we are, but I'm not sure like what their
population is.
Yeah, and what their intubation rate is like. Has there been a shortage of vents? And from what we've seen, not really. It seems like anyone that's needing a vent is getting one.